such an insightful lecture and the discussions and reflections. It's really nice actually to hear. So I remember very vividly doing the CTP project actually and doing the presentation, and really you feel the sense of kind of collaboration in that. There's something, I'm struggling to find the words, I'll articulate it clearly, but it really makes a difference, I guess, going out and actually speaking to people in the community and learning from their lived experiences, I suppose, than compared to, say, kind of lip sitting or reading, which I think in institutions like Imperial you kind of can go down that track quite easily. So thank you again. We'll now be moving to the second part of today's session, which is our She Leads interview led by our co-director Celine. So this segment will focus on the unique experiences, challenges and wisdoms that Dr. Sbaiti has faced and acquired over the course of her career. And I'm sure you're all looking forward to it as much as I am, so I will hand over.
Thank you so much, thank you so much, Len. So we'll try to make this as informal.
Yes.
But I would love to get your insight on a few things, especially the main theme of Lady Amalia, why it started. So it's just to understand a bit about, can you tell us some challenges you faced going into this global health field as an educator, and especially as a woman, and especially with your background, and I'm going to say that especially with your name and family name. What are some challenges that you found, and how did you overcome them?
Yeah. So I guess I'm going to go back to the picture on intersectionality for this one, because for me so looking at the challenges and possibilities, right? There's been lots of possibility in my life up to here, that's led me to be able to do the work that I do today. So taking an intersectional lens then, for me the biggest challenge actually in kind of starting work, or even just going through medical school, or starting to work at Imperial, was the kind of unknown rules about how to operate in an institution. So I didn't necessarily have, when my students talk about the social capital, which I've now, learned more about and read more about in kind of education. There were certainly things that I wasn't getting. I didn't have a parent in medical school. I didn't have a parent who was a doctor. I didn't have. There were bits of the script that I was missing, and I was really conscious of that. That's one answer to that question. The other side of that, though, is complex because it's intersectional. I've had huge privileges that have basically enabled me to get here. I've had, been supported financially by my parents. I went to a private school, a European school in Brussels. And actually, I think growing up in Brussels in the 80s and 90s, I don't know if anyone's been to Brussels or been sort of grown up or visited the place, but half of my family is Moroccan, and a lot of my family is in Belgium, and the other half of my family is Italian. And actually, I would really saw, just like I was mentioning about the divide in this local area, for me, I really experienced Brussels as a divided city. So there was my family, my Moroccan family on one side, and then there was my school and my mum's job on the other side, and my dad driving a taxi as a taxi driver going between the two, and do you know what I mean? So it was, and that's what I think. So I've had huge privileges to get to get me to this stage. But I think what's helped me, for example, to do the work with my students is that I've also experienced very much inherited some of that alienation from, a city that was where the community, our diaspora community, experienced a lot of racism, a lot of alienation, and still does to this day. So, but particularly in the 80s and 90s, it was tense. So tensionality is something I can relate to. Being a woman, I think, has almost helped me. I'm going to say that because I know that the second generation in my family, for example, the boys have really struggled, and this is something that we know in terms of mental health. Actually, we know that second generation mental health immigrants struggle. I've seen that. I've seen very close people go through that. I've had conversations a few months ago about that with family members. And the fact that compared to my siblings, I pass for more white than I might have done, also has helped me. So it's a complex, combination of things, and there have been times when I felt alienated, or I've sort of received some racialized comments in my work, for example, but I know that I would have experienced a lot more of them had I looked different, or had I spoken differently. So it's given me awareness and it's given me privilege at the same time, if that makes sense.
Absolutely, and it's that inner knowledge that you've lived your childhood knowing that difference, and it gives you a bit of insight that other people, and that lens that we talked about, even with a VR set, but at least there's a lens there that you can see how you can navigate better through it. So just talking back about your journey, I'm just gonna ask for one really proud moment you've had. One proud moment or something that you're really proud of so far in your career?
It's a good question. I've shared a couple of proud moments on there, and I think for me that's what it is. It seems like it's maybe the pictures that I put up seem like they could be any picture from a teaching moment, but what was actually happening there was, for me, really important. I was crying and I've watched the documentary many times, but I was again this year crying after watching it. It's almost like it's as transformative as it is for me as it is for the students, and I think that's the thing that I'm really proud of. But I'm also really proud of kind of having that network around me and that team to work with, who are committed to education. I'm really proud of the work that everyone is doing around me.
Thank you for that. And if you could change one thing about working in STEM, what would it be?
So is that particularly at Imperial, or is it just generally in STEM?
Can we focus on Imperial if you're comfortable? If you're comfortable with it, saying about Imperial.
I mean, interestingly, I was at a symposium this morning, and I did a shout out to someone in the audience who was a colleague from Imperial who worked at SHARES, which is our Centre for Higher Education Research and Scholarship. And I think that relationship, for example, with Anil Cohen was really productive, because I've been in some ways kind of wishing for social scientists to show up at Imperial. I know we had a social science unit in public health, but then it got dissolved. I know that there's talk for a college level social science department, but I think that it's almost worrying when we have a STEM only focus without the ability for that interdisciplinary work. And I think we keep each other in check, and through collaboration. I wouldn't have been able to do that work had I not been able to do it in an interdisciplinary way. So I think that's one of my wishes, but I'm sure I've got more. So yeah.
Well, thank you for that, absolutely. And it is a big issue we do have at Imperial. And just my final question then would be, if you can give a piece of advice to young academics that want to come into the field and work in a place like you work in Imperial, what would that be?
So when I think about, we had a career session for women in global health a couple of years ago, and I remember having a really good discussion with a few colleagues around that in that panel discussion. But I think one thing that I think back to is a lecture that Jonathan Weaver gave to the year 1 medical students a few years ago, on how he basically came into his kind of leadership position as Dean of the Medical School and of the Faculty of Medicine, and he started off with just basically in his clinical career, finding it interesting that there was a ward with AIDS patients in the 80s that no one was really interested in, and he started kind of doing some research on that, and then started becoming interested in something that no one else was interested in, and followed his interest. And I think I can't speak to everyone's experiences, obviously, and everyone will have different routes. But for me, this is something that resonated with some of my work, because I felt like at the time when I started questioning what was going on in the classroom, I felt that there weren't many people who were asking so many questions about something. So I was obviously kind of interested in that, and I think that's something is the kind of the curiosity and the freshness of coming into a new field with your perspective is something that's worth holding on to and not losing, at least for a while. Yeah.
Well, thank you for that, and I think it's something that I hope they can get from this, and we're going to share this recording hopefully, and it's that kind of curiosity that should never die. I believe is quite an important message, at least, that we can end this interview with. But thank you again so much for your time. Do we have any questions before?
Yes, we have, Shani, are you speaking, or we're going straight to the questions? So we have one question from Jawani. Sorry if I pronounced that wrong. Would it be best if we can flip the geographic locations of the Global Health Masters training in 10 years' time? So in a decade, would it be better if they were being, Global Health was taught in the Global South, but then it would just be public health, wouldn't it?
I think this brings up so many questions about how conceptually fraught the field is, actually. But I think any change is probably positive in the sense of redressing that geographical imbalance. So I mean, I'd be curious about what the person asking that question, what are your thoughts around what it might look like to invert the map?
It's quite similar with humanitarian work as well, that people are trained in the Global North to go work in the Global South. Why are we not training people in the Global South to work? I think I read somewhere someone did, they were doing their masters or something, and they wanted to work with the community they were from in the Global South, but they had to go to a Global North university to and then they weren't allowed to go and work with their own community. They had to go and work in a different place, and they were like, this is the community I want to work with.
Yes, exactly. There's a whole load of paradoxes. I think that the thing about that particular, consideration and whether we should do that, I think that would be a massive improvement. But the challenge to that is that there's a whole economy around global health that brings some of those that international development funding back into high-income countries. So yes, if we give up on we increase ODA, we give up on the funds coming back into our economy, then yes, let's relocate that. I think, that would be great. But yes, one of the challenges is that we are almost dependent on that economy. And there are places like Boston where a lot of the local economy is based on global health. So yeah.
Did we have any other questions? Anyone online?
No. We're done?
Yes.
Yeah, perfect. So thank you again.
Great.
Thank you so much. And hopefully we'll share everything on our social media, and we'll definitely tag you and have that involved. But thank you again for very insightful. And I think if anyone has any other questions for Dr. Mariam, just send them through and we'll relay them back to you.
Yes, please do, and I'd be really interested to hear about anyone who's keen to kind of share thoughts on our work or feedback or anything like that. So please,
So much.
Thank you.
Thank you.
Thank you.